I have always absolutely loved this more alternative space from the conventional world. My saying I always go to is spirituality offered an environment of safety and vulnerability where conventional practice never really had that space.
Welcome to the Holistic Counseling Podcast, Tina.
Hi,
So glad you're here.
me too.
So let's start with what first interested you in moving towards more alternative modalities?
I have to say that my own personal experience with engaging in spiritual practices and holistic treatment interventions is honestly what really made me drink the Kool-Aid for this. I have always absolutely loved this more alternative space from the conventional world. My saying I always go to is spirituality offered an environment of safety and vulnerability where conventional practice never really had that space. And it was just always because of that, of like working with certain practitioners that were really like in it with me and encouraging vulnerability more and more, like almost championing it, like, so allowing me to uncover pieces of myself. Like, I just loved that because most of the practitioners that I've worked with, they practice this on a regular basis, where sometimes in the conventional world, you'll work with someone and it doesn't mean that they're following what they're teaching
True.
all the times. And everything gets a little too rigid over in that conventional world. So for me, it's always been through my own personal growth journey why I've always just loved holistic, spiritual, and alternative methods of healing.
So can we go into that rigidity you mentioned, and what are some of the limitations of more traditional approaches?
There's always this push for integrating empirically supported treatment modalities.
Ah,
Um,
I had to say
I know, like, ugh, the ick, right? Like,
yes.
and I've always found this to be so confusing to me because there's no way that the way it was researched in studies is the way it's actually being applied. Like, you take
Oh,
this
for sure.
humanistic piece out of it, most of these are running groups, even like CBT models and stuff like that. Like, they're measured in a way that like you wouldn't really see as much into the kind of conventional world. But because there's research behind it, it's like it's the goal, it's the holy grail like of things. And I've actually sat down recently and I was like, you know what, let me just take another gander at evidence-based practice to really like understand this concept, because I do think it's important, but I
Sure.
don't think it's everything. And I think what
I
ends up
appreciate that.
yeah, it is not everything. And evidence-based practice has three stools to create balance. And I think what ends up happening in our field is we only focus on one and drop the other two, which is,
Mm,
of course, you want to search for research that is available. Duh. That would be helpful. Like, have we
mhm.
researched this? Have we looked at it? Does it help? But then we forget about the other one, which is clinical expertise and knowledge. And then the other leg, which is, client preferences and values.
Mm.
So I think for a lot of us who are integrate holistic, complementary, and alternative interventions in clinical practice, it comes from our clinical expertise and knowledge and application. And it aligns with all of our, the clients that we're working with, what their, philosophies on health and wellness are too. But then it's all
Yeah.
about, but where's the evidence? But where's the evidence? And I like to remind people that most empirically supported treatment modalities, they were all just woo-woo thoughts at some point. I mean,
Yeah, that's true. That's a good way to look at it,
you think
yeah.
about EMDR, so she's just sitting in the
It's
park
like,
looking at
"Whoa, what is
her,
that?"
like, "This is something." It's everyone thinks you're crazy until all of a sudden they think you're a genius.
This is true.
Yeah.
And what about I know you mentioned the stool, but I guess is there a part for the therapeutic rapport too, as far as healing goes? Because
Yeah,
that's just the basis of all
that's
therapy, isn't it?
everything. It's everything. That relationship
Yeah,
is
yeah.
everything. If you even think back on any healing space where that you've allowed to ascend or grow, it always had to do with someone holding safe space alongside you and giving permission for that to exist, right? Like, there was that beautiful relational piece there. But just unfortunately with the third dimensional world we're in, it's just not given enough space that it needs.
Yeah, because I'm thinking if you just jump in and let's just do CBT and be a robot, but we don't have therapeutic rapport, is
Nope.
that really gonna help a client?
Well, I think, being able to show up as a healthy model as a clinician, it does take a lot of inner work.
It really does.
I mean, I've I've joked, but it's not really ha ha funny that like I was a really dangerous therapist in my earlier years. Like I
Mm,
didn't understand my wounds. I wasn't
sure.
really practicing what I was teaching. There was all of this disalignment, unalignment, and I felt like an absolute imposter. And really it was like, do I really understand myself, my story, everything I bring to the table, and how to heal it, how to show up for it, how to nurture it so that I can actually do this for other people as well. Like if my capacity increases for me, my capacity increases for other people. And sometimes, I'm not saying all, but individuals or therapists that kind of really fall to these ESTs that are like, oh, I got to do it this way, they really detach themselves in treatment and just make
Right.
it all about the model.
Yeah, because I think it's less open for me. I just feel like you said, the rigidity. It's because I feel like I'm evolving so much more now. I feel like every day sometimes it's like today I did something, this breathing and visualization that just came to me, and I don't know if it's spirit guides that's leading
Yeah.
me, or and I had never done it before, but it worked beautifully, and I was like, I'm just going to flow with it.
Yeah, I always joke and say that healing's a scam,
Yeah.
because you never actually finish. Like,
Yeah. Yeah.
it's why I changed my business to, like, the name Dimensional Wellness, 'cause I was like, "Okay, so you're in this process, and then
Right.
eventually you reach the top, but then the next level, you're at the bottom, like, you're entry level, and,
Sure.
like, you know nothing, and it's uncomfortable, and then you until you unlock that next layer, and if you're lucky, this goes on forever."
Right. Yeah. And it's just like, I think too, just being a mindful therapist is so important to be tuning in. And I don't know if is that evidence? I don't know if that's evidence
Mindfulness? Oh, there's
based.
a ton, yeah, like, I mean, there's so much information on therapeutic rapport and research, like, hard
Yeah,
evidence, and in my research recently, like, I've been finding so because 'cause I've been doing the digging,
that's
I've
true.
been
Hmm.
finding just so much more on I found a beautiful article on how the benefits of meeting with a psychic in comparison to a
Mm. Are
psychiatrist.
you serious?
Yes, I have it, it's in my group, it's under the files section, I was like,
Nice. I gotta look that up.
yeah, because I was like, okay, well, if we want to say if there's research available on if, psychic mediumship can benefit someone who has distressing symptoms, well, boom, I have an article right here.
Wow. Isn't that awesome?
I know, thank goodness people are actually like, because publishing
Yeah.
articles is a pain. I'm not gonna
Of
lie.
course. Of
I've
course.
have hated the process every step of the way. However, once I realized the benefit to it, now I'm already like, okay,
Huge.
next, let's look up some more stuff. Let's do some more
It's
research.
changing the world, right? I
Yeah,
mean, really, and
yeah.
perception. And let's talk about what we're naming here, because I know a lot of what you said. I know we were talking before I hit record. You mentioned complementary and alternative modalities. In
Mhm.
this podcast, we talk about holistic modalities. Are we talking about the same thing?
Yes, I'm going to say that we're talking about the same thing. And I think, when I first started exposing myself more to this world and educating therapists, I kept using the word holistic, and I wasn't really finding the therapist I was looking for because I think holistic has different definitions sometimes to different people.
Sure.
So holistic, people are like, oh, I'm just taking a bunch of different approaches and incorporating it into one. Or some people think of it as like mind, body, spirit interventions. Are we focusing more mind, body? Are we focusing more spirit, body? Like, what are we doing? But it's basically when I talk about complementary and alternative interventions, I'm more talking about interventions that you would be considering non-traditional for the mental health space, but
Hmm.
very aligned with health and healing. And the reason I had to use that terminology was because when I went to my doctoral program and I said I wanted to study holistic modalities, when I started looking for research, I was kind of hitting walls. And I wasn't really finding what I was like, I'm talking about energy work. I'm talking about spirit guides. I'm talking about crystal healing. Like, this is what I'm talking about. And I remember one of my professors saying, you know what? Maybe you should look up the term complementary and alternative medicine.
Gotcha.
And I
Yeah.
originally was like, medicine, social work, those are split. But then I just switched the word medicine to interventions. And then I started looking at the different categories, which is, like whole body systems or mind body interventions, energy work, things like that. Cause there's like 5 categories that fall under that. And I was like, okay, this is what I'm talking about, but
Oh,
also
okay.
like spiritual practices too.
So that can fall under it.
Yeah. So it's not a term I love. I didn't make it up.
That's
Um,
okay.
but it's definitely a term that when it comes to research and building in that
Yeah.
space, it's a term that is well understood and established. And I say to people all the time, like, I understand that a lot of these interventions, so to say, are also ways of life for many people in indigenous practices. And I'm not trying to, discount that or take away. I'm just trying to give language to something that is misunderstood a lot of the
Yeah,
times. And especially in the
true.
therapy world and mental health, oh, woo woo, because it already kind of like discounts it sometimes when we like use
Sure.
those languages, or, people say pseudoscience, but I'm like, no, like these are they're just alternative and complementary to what we know as conventional mental health practice, but still work.
Yeah. That makes a lot of sense. I can see that, especially with academia, because holistic, they'll be like, "Ooh, I don't know. I don't know about that." And
Yeah.
that
Or
can
they'll,
make people really uncomfortable. And
or, I'll say holistic and they might think mind, body wellness or something. But I'm thinking like, no, I'm talking spirit guides, archangels, like
yeah,
I'm talking these people or these things, I'm not just saying, that. So then people are like, oh, well, no. Like, so then yeah, it's just very difficult to talk about this and have the language
sure.
around it.
Have the
Yeah.
same understanding, I guess. Is that right? Yeah. Okay. So, what have you found with statistics? I know that was something you mentioned that you've done a lot of research on with the benefits. What benefits have you found?
Oh, well, I mean, the research I'm finding right now is that consumers, they are dying for therapists or healers to bring this into the space. A lot of individuals, when the conventional world fails them, they jump into spiritual realms. It's just, I mean, it's exactly what happened to me. I was severely anxious, but didn't know I was an empath at the time. Went on Zoloft, saw a therapist. Was my healing was very slow, like a snail. Like enough, it was like just enough to like make me survive. And then like found myself in front of a psychic intuitive, and I was like, what is this? Like, I need more of this. Like, now I'm interested.
Yes.
I'm curious. I'm motivated. Like, what is this? Even for me, like, I grew up in an immigrant Italian family. Like, we don't talk about that. First of all, we don't talk about mental health. And if I start talking about like psychics or intuitive, like my mom will
Oh, I
go,
know.
yeah, yeah. But I mean, she's definitely a more progressive now. But like, otherwise people will judge you. There's so many research articles talking about a lot of it more in the medical field, because with the mental health field, we tend to follow suit to medicine and nursing. So a lot of the research in our field is still at an infancy, I'll say.
Hmm.
But in medicine and nursing, like they're actually developing guidelines for how nurses can integrate complementary and alternative medicine, how
Oh,
doctors can do
wow.
this. But there's nothing for the mental health space right now, because they were starting to see that all of these interventions were improving overall quality of life, allowing the human who is involved in the treatment to actually feel a part of it, to choose interventions that were aligning with core values and philosophies. And if anything, I'm like, man, if we're not talking about this in the mental health space, if we're not even asking, like, hey, are you interested? We pose the risk of alienating our clients based on the research that we have available. Because there are a lot of
Yeah.
people who are very
Hmm.
much into this. But then again, they're not going to walk into a therapy session with someone they've just met, don't know, and be like,
Sure.
hey, I'm kind of into oracle cards too, like, and real talk. Some therapists are very judgy and attack like
Sure.
and not open, and it's very jarring to me as another professional, and I can't imagine if like the feedback I get from bringing this to the table, what a vulnerable individual battling a mental health concern might feel if they bring it to the
Absolutely.
table.
Well, it's not always safe.
No.
And I feel that sometimes too. And I've talked a lot about that on this podcast because even somebody I don't know, if I make a new friend, I'd be like, I got to feel them out. Like, how are they going to feel if I talk about spirit guides or oracle cards? And what's funny is I've had friends over to my house. I had a new friend and I had my cards out and she's like, oh, those are cool. I was like, yes. So
My
we can look
people,
at
like,
those.
where
I know.
I don't have to hide all parts of me.
Whew. It's like, whew, okay.
Yeah,
Yeah.
it's just such a breath of fresh air to be like, I can be me in this
Yes.
space and you can be you, and no one's at odds with each other, and it's totally celebrated.
Yeah, and then we can take that into the therapy room and be
Oh, yeah,
ourselves with our
we
clients, right?
I listen, you can't teach what you can't model. Like, so if
Ah,
you can model this and be this, it is just easy progression to bring it into the therapeutic space.
yeah, because I know that's something that you talk a lot about is that authenticity for therapists too, and because I think it kind of feel like that rigidity. It just therapists get blocked from being who they are. Can you talk about that too? How can therapists start to embrace that authenticity?
Yeah. So in my own personal journey with this, I used to, they teach us about clinical theory, right?
Hmm.
It's like one class in your master's program, and then you never really hear about it again.
Of course.
Except when you're in for an interview and they say, well, what type of theoretical model do like whatever. I don't even know if people who are interviewing actually know what they're asking. And when you haven't been in a space where you get to talk about this a lot, it gets really uncomfortable.
Yeah.
And a lot of people, I know I did, I was just like, oh, I use a cognitive behavioral approach because, that's safe, right? That's a safe response.
Yeah.
And then, what I did is I took an assignment I had for my doctoral program and I just expanded it on a little bit. My professor had given us an assignment called Theory for Change. And she just asked some prompting questions about like our experiences growing up and like how we developed an understanding of human behavior. Then what I did is I kind of asked myself a few more journal prompt questions in this area. I was like, okay, like what role did I play in my family? Like what belief systems did I establish? What were my aha big shift moments? Like what were the interventions I started using and why? And like what was the narrative of my transformative journey? Like what how did I go from A to B to C to D? Like what happened here? And then when I looked at that, I was like, I wonder which clinical theories these match with versus like me picking a theory and then embodying that theory, just
Mm.
one or two. I was like, let me take my own story and my experiences and then match it to a clinical concept that makes sense for me. And for me, like there was a lot of, transpersonal, person centered, psychodynamic, humanistic, existential, young psychology. Like that was really big in my understanding of self and my transformation. So I always say, like, when people feel like they're an imposter in the therapy world, you got to go back to your own story because there's probably something that maybe you overlooked or you missed, or maybe you haven't healed yet, and just give yourself space for that. So what I do with some of my coaching clients is like all my coaching clients, we do journal prompts for their story, and then me getting to be the objective party in this, their subjective experience. I'll be like, I'm noticing a pattern of this, 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 and this. Did you ever see that before? And most of them are like, wow, like I had it, so it's kind of like when you sit with a client and you're talking to them and like you're bringing like, like to the table and they're like,
They're like,
wow.
whoa. Yes.
Yeah. And then I'll look at some clinical theories and I'll be like, I'm seeing this here, 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 and here. How's that feel? And they're like, wow. So then like we build this kind of integrative clinical practice framework, pulling from their own story and then seeing how it shows up in their work with clients. So like you can really embody aligning your own personal story in your sessions with clients. So that
Mm.
like you don't feel like you're this imposter, because the language is important for the therapist. Like most clients, they don't care which clinical theory is. Like
No,
they just
they
want
don't.
they want a
Mhm.
competent, confident clinician. And to me, I haven't found a more like an easier way to build competency and confidence than to embrace your own story and then build your framework for how you do work with clients.
That makes a lot of sense. That's who you are.
It's who you are and who you were meant to be. And those experiences,
Yeah.
like
Mm.
I like to believe that everything I went through matched me up with my ideal client.
Mm.
Because
Yeah.
I can't tell you how many times I've sat across from my clients and they've told me my own story, and I'm like, "Damn, what? We're here." And thank goodness I've processed through it and
Yeah.
I've nurtured those parts of myself where
Sure.
I can talk from the wounded place of experiencing it and the healed place of experiencing it
That's true.
and bring
Mm.
both to the table.
Bring both
It
to the
makes
table. Mhm.
hard conversations very easy because it's my lived experience.
Yeah, exactly. And I wonder if you feel this way too about self-disclosure. Do you feel like being more authentic that you are able to share more of yourself with your clients in a
Oh,
therapeutic way?
Oh yeah, I definitely, sometimes definitely use a relational approach, but I also like I will speak to my connection to the feeling, but I don't get into context. So I won't be like, "Oh yeah, my ex-boyfriend did," but I'll be like, "That pain you feel when you know you've poured everything into this space and then you have this acknowledgement that it is not it. But then if you look over here, you're scared of all the embarrassments. Like, whew, I can feel that in my chest. Like I know what that is." And then like to align, like I get chills talking about it. Like when you really hit, like I can share with you that I have been in that space. and I can give some words to it now, and I could share that with you,
Mhm.
no problem. Or how I'm still, I still experience stress. I'm still, life still hits me the way life hits everybody. But I love it because I always tell my clients, like, I'm never going to promote, teach, or guide anything I don't do. It
Exactly. I'm
keeps
right
me,
with you.
yeah, it keeps me very authentic in that way. But I think it's important to own the vulnerability that, like, poor choices have been made on my part. Negative things have happened. I've
Yeah.
definitely co-signed poor decisions. For me, the only way to change that had to be conscious awareness of what I was doing,
Mhm.
and then helping bring that to the table for them in their story, but in a way that's not shaming, because I always say shame doesn't create change.
Exactly.
Yeah.
And I think that's so helpful because sometimes clients are so surprised when I'll tell them a scenario or something recent that's happened, just like you said, just with the context of that, of, oh, well, I've gone through something like that similar, and this is how I went through that. And I just talk about the polyvagal ladder a lot and using that with yoga, and
Yeah.
they're just like, their eyes are like, what? Like you get stressed? Yes.
It gives you permission. I feel like in
Yes.
some sense, I had gone to it was like this boot camp class through a holistic practitioner, the Lifeline technique, which is something I'm certified in. And I remember the activity that we were given was to discuss, like, the parts of ourselves that we're trying to hide and the parts of ourselves that,
Mm,
like, we want to embrace, and to also, like, speak with a microphone the most embarrassing, most
mm.
regretful story we've ever had. And I remember being like, I'm in a room with people I've never met before,
Oh my gosh.
right? And my heart is like, there's no way I'm gonna be judged. But then people would share their stories, like, really, like, sad moments of, like, stuff from, when our frontal lobe isn't even developed yet, and things that we did, and, like, whatever, and then seeing people celebrate and cry and hold space, and I was like, this I was like, "What is this?" I'm like, "I love this." Like, I'm like,
Oh, that's so
me next. Let me tell
nice.
you about this horrible thing that I did." Like, and it just was, like, so cathartic and beautiful, and, like,
Oh,
when are you in spaces like that where people celebrate you owning
never. Yeah.
the darkest parts of you?
Yeah, vulnerability
Oh,
invites more vulnerability, especially in
yeah,
a safe
it's you wanna talk
space.
about a strength?
Yeah,
That's it.
that's
That is
it.
it.
Yeah, being open, and I get more clients too that really like directness, and I'm like, "I'm gonna tell you what's up."
Yeah,
It's like, most people want that. I'm gonna be like, if I'm not gonna bullshit you. That's what I
no.
tell clients.
I am the same exact way. I always say, like, "Listen, do what you want, but do it
Yes,
purposefully." So don't bullshit the bullshitter. If
exactly.
you're gonna go do the toxic thing, I want you to own before you leave your
Own
house.
it.
I'm getting dressed and putting my makeup on to feel undervalued. Like, and you know what? If you love it, I love it. Like, let's just call it what it
Let's
is.
own it.
Let's own it.
Oh, we got off on a tangent, but that's okay.
It's all about authenticity, so it's not too far off.
Not too far off, I guess so. But I was wondering, is there any misconceptions that you can address too with some alternative complementary modalities that come up?
Oh, misconception. I mean, all of them.
All of them. There's a lot.
That, like, that they're woo woo, that they're not. There's no evidence to support them, because there is. It's just that people don't do their due diligence to look up. I mean,
True.
I probably have 60 pages of at least, like, 10 references per page that I can pull from. Like, so I know that the research exists.
Yeah.
Um,
True.
and, like, and it doesn't have to always be like these RCTs, like these randomized control studies. And, like, research comes in, like, a hierarchy. So there's levels of it, right?
Yeah.
So, it doesn't have to be just this comparison group stuff. It's about, reflection,
Hmm.
about the integration or case studies individually. Like, they do exist. And there's also a ton of dissertations that also haven't been published yet. And I get why you're tapped out at the end. You're like,
Sure. Mhm.
this, I don't like, by the time you got to take on me, I 160 pages. I had to make them into 30, change this, change this, change this, submit it, all those
Right. Mm.
pieces. Like, it's a lot. It's overwhelming. I get it. But, look for dissertations. I have found so amazing dissertations on, like, integrating alternative practices into the mental health field on, like, ProQuest. And they're all, like, free and available. I was
Oh,
like,
okay.
do your due diligence. And this is what I teach. I'm always just like, we got to find at least one article that backs up what we're talking about. And let's just say, like for me, for instance, I don't have any research on human design, but there's concepts around human design that like really align with CBT. Of like kind of changing your restructuring of your belief system of self and like
Okay.
so I match stuff like that, so it's like there is something as long as the foundational
True.
piece is there. But yeah, there's just so many misconceptions about this stuff, and I always say like if you're have you done it, like before you judge it, before you put a stamp on it, let it's whatever, be a part of it, experience it. Because the thing
Mm.
with I find with complementary and alternative methods is because we don't manualize them is what makes them beautiful. Like I've met with different yoga instructors, Reiki practitioners, psychics, oracle readers, and everyone does it different.
Yeah.
And everyone's way is beautiful. And I'm here
Yeah,
for it. And I
that's
have a
true.
growing, piece of that. The other misconception, which I don't know if really has to do with the complementary and alternative space, but the misconception about the boards and like scopes of practice
Yes.
is I have been attacked by the keyboard warriors on Facebook before about
The keyboard warriors.
yes. That's actually I have to my friend Carly has used that term and that's exactly what I
That's
consider
funny.
the keyboard warriors. They come at you. And I remember someone saying, like, the board is explicit, evidence-based practice only.
No, they're not.
Sure ain't. Because I've read about 20 different states, like scopes of practices. And I just do a little, command F, and I always look for evidence-based, empirically supported, complementary, alternative, whatever. What I do find, you need to know your clinical theory. That's
Yeah.
in there,
Mm-hmm.
but that's it.
I know. I've looked too. Yeah.
So, and I'm actually, you'll love this. I'm actually starting research. We're going to research all 50 states, all professions, and look for all of these terminologies in order to bring awareness to like the fact that we don't have to be so scared.
Awesome.
We do not have to be
I'm
so scared.
actually teaching that today of my yoga course that I'm doing, yoga basics, on the scope of practice, scope of competence.
Yeah, it's like where did we get this fear from? Because it's not really there. But man, like even me, like I totally believed it for so long. But then I hired lawyers and
Yeah,
I'm like, there's nothing here. What are you talking about? And then when I email the boards,
exactly.
they go, we don't have anything on that.
Yeah,
So I'm like,
I actually met with because I'm LCMHC with the ACA. I
uh-huh.
met with their ethics committee. I met with somebody that's head of ethics and talked to them about this too. And we went through all of the ethical guidelines.
Yeah.
And she's just like, well, let's look at this. And she was just like, okay, well, you're following everything you need to follow for yoga, and you're getting your training and your scope of competence and practice, and different modalities was one of the ethics. There was values, make sure you're not putting your values on clients.
Yeah. But
You're
see,
meeting
like
the guidelines.
yeah, I think what happens is like, when people then they don't give guidelines,
Yeah,
they're don't know where to go, but at least like I know you teach
absolutely.
it, I teach it. It's like, okay, just because there's no guidelines, it doesn't give you a free pass to willy-nilly
Oh,
insert
no.
whatever
Yeah.
you want to. Like you still have to build competencies around
Sure.
this and do your
Yes.
due diligence and,
Yes.
and and be able to track it and say like this is how I've, be able to have an answer.
Oh,
You can't
yeah.
just be like,
Yeah.
"Oh, yeah, I'm not worried about it." Hands well, no, like, you need to know how it's helping. You need to be able to you have words to say, like, how this
Yes.
is covering different pieces.
Yeah, for sure. So I'm glad you're saying this. This is a great conversation. I appreciate this because yeah, I get lots of information and questions from people that are just like they haven't done anything, and it's kind of sad, like you said, because everybody's got so many gifts they can offer their clients and so
So
much
many
healing.
gifts. Yeah, and
Yeah.
I think, honestly, we need individuals who are holistic practitioners at this point that integrate these kind of non-traditional models. Like, if anything, we really need you all to understand the language to support what it is that you're doing, like build those competencies
Right.
because when we're put because we are going to get tested more than the
Yes.
average textbook therapist, right? So
Oh,
we
yeah.
need to be able to say, this is exactly how, the lifeline technique aligns with psychodynamic theory. Let me provide you with some information on that should you like. This is the research that we've been doing on this and this is,
Yes.
whatever. If you don't have that, you have nothing. And then you basically just reinforces that. Like, and it's not to defend, it's so
Sure.
that we know that we feel empowered in what we're doing and we can speak on it. And we should.
Absolutely. Yeah.
I mean, I know that most, like what I do, I know most textbook therapists probably won't even know. If I said, well, really talk to me about how you integrate whatever EST that you do and how it aligns with a clinical theory, I feel like they're going to stumble on their words.
Yeah, I
And
know.
it's only because, the system isn't built for us to like learn
Exactly.
this stuff.
In your bio, you have lots of different modalities and lots of things that you've studied. So how do you integrate that? How do you determine what to use with clients and figure out what the individual needs are? And because I think that's a question a lot of listeners have.
Yeah. Well, for me, I call them like spiritual downloads. Like I'll just have moments where like, I do move in a very clinically based modality when it comes, but then every now and then it'll be like, grab the cards. And I'll be like, I'll ignore it for a second. And then it's like, grab the cards, like louder. I'm like, okay.
Okay.
So then I'll just say like, honestly, all of my clients are into this stuff. So, but I've done a good screening process with
Sure.
my onboarding. But before, when I was first kind of dabbling, I would just be like, there's some practices that I use outside of, this realm and in my personal life that really help me feel grounded, get answers and get reflections. I'd love to incorporate it in this space with you. Would it feel safe to, and then we'll talk about whatever it is.
Sure. Mm-hmm.
And human design, like I've really loved because it just kind of helps you have a new spin of understanding of yourself. Like, so I'm a generator. So I'm someone who loves to have their hands in multiple things and master multiple things. But I used to think that this was a negative aspect of me because I couldn't just pick one thing.
Okay.
Or people used to tell me like, you know what, why don't you just get a job, work there for 20 years and get a pension? And that would give me the ick. Like, I was like, I can't, like, you want me to stay one place for 20?
Right.
Absolutely not. Or I would stay at a job for, 2-3 years and I'd ready to be out. And it's because for me, once I've mastered something, I'm done. Like, there's no more reason for me to stay there. So, like, this new understanding of me was like, oh, okay, like this is exactly the way I'm supposed to be going. So it just gave me a brand new reframe, like
Sure.
on my
Yeah.
life. And then even like learning about my profile where I'm like half hermit, half like educator. So like I'm just taking all my knowledge and like kind of hoarding it. And that feels comfortable for me. But then there's a part of me that people expect for me to teach. And I'm just like, I don't know if I could do that, and now understanding that like people view me differently than maybe I view my internal knowledge and stuff like that. So it just really helped. And when I got into human design, I was like, hey, so I learned something. And I would tell my clients what it is. I'm like, do you want to look up yours? And they're like, hell yeah, I'm gonna look up mine. And then we would look it up. And then I'd have all the books and they'd be like,
Nice.
like, this is me. So like, I love that stuff.
So it sounds like too that the clients that you see, you said that you do a vetting process too.
Mhm.
So tell me about that. How do you vet
Well, I'm
clients?
very clear, like on my, I talk about my personal journey and
Mm-hmm.
my love of integration of the two worlds. So usually when people meet me, it's usually through referrals. So they kind of already know, but I always say this, like, I love the clinical world and I love the spiritual world. And there is a bridge here and this bridge never breaks.
Mm.
I was like, you'll never catch me on the all the way over here and you'll never catch me all the way over here, but I will run back and forth.
I love that.
So if that's not for you, I'm not for you. Just
Perfect.
so you know.
Yeah.
Um, and usually they're like, no, no, no. And I also like do a scaling on the intake, like how open are you to integrate certain
Ooh, I like
things?
that.
Yeah. And if you aren't, tell me what your fear is about that or your apprehension is about that. But I definitely integrate and ask. And like I've even I've done some research with my own clients about like, tell me about the fact that I bring this stuff in, how does that help?
Mm-hmm.
Because as I'm training new therapists to really
Sure.
own
Yeah.
this stuff, I want to give them some like definitive
Yeah.
evidence that like
It's
this
true.
helps clients.
Yeah.
Like I know you're
Exactly.
scared, but like the right client
Hmm.
will find you and this is the kind of outcomes you're going to be able to have.
And I hate to say it, but I don't hate to say it. But the research shows from what I'm doing when these clients are doing so well, from the clients that I see, it is absolutely phenomenal. The integrative approach, it works.
It's accelerated healing.
It's accelerated. Yeah, that's the word. I'm trying to think of the word. My brain's not working today. But
Yeah,
yeah,
that's
just because
exactly
I
what it
use such multi-layer, it's just like you. I have so many different things that I'm using with brain spotting and yoga, trauma informed yoga, and a little bit
is.
of parts work. We throw in there, a little bit of this, a little bit of that,
Yeah.
stir it all up.
Yeah.
And it's phenomenal. It blows me out of the water, you know.
Yeah, it's like because when you box, I hate getting boxed in. Like, don't
Yes.
like the minute you tell me this is the only way to do it is
Oh God, I know.
I'm just like, okay, get me out of here. I said treat everything like a buffet. Like just take what you need. Or leave
Exactly.
the rest.
Yeah. Yeah. And there's not a research study that shows that for these clients, but their lives are changed, right? I'm releasing
Yeah.
people from therapy and their
Yeah.
lives are changed for the better. And I think that shows something
Well, we
that,
are getting there though, because I did find
yeah,
an also article. It's also in my group under the files,
nice.
where clients were actually indicating like the benefit of integrating this stuff was like
Yes.
just way better than like just going to see a
Yeah.
psychiatrist or just whatever. And I was like, see, like,
See, there it is.
but the problem with research is like the average, like I think it's like a 14-year average. I don't know if it's changed. Maybe it's 10 years, but like
Yeah.
someone will do research and they'll take like 10 to 14 years before they actually publish it.
Ugh,
And I get it. I do. And that was my whole thing. I was like, I can't do this. I took a year off, like completely mentally
I'm
checked out. And
sure. Oh my
my old
God.
committee chair was like, you ready? And I was like, okay, like, let's do it.
Hmm.
But I'm so happy I did because again, it's just
Yeah.
they're popping up more. Like good articles too.
Yeah.
Like they're starting to pop up.
And what's your group? Can you just share that? I know we'll put it in the show notes because people
Yeah.
may be wondering.
Yeah. So my Facebook group is the Black Sheep Therapist, embracing unconventional practices in mental health.
Woohoo.
Yes.
Yes, awesome. And I so appreciate you with all that you're doing. And this is like promoting so much. I feel like you and I together are just paving this new path for mental health therapy. And it's so exciting.
It is. I've been saying this like over and over. Like this is, if there was ever a year for innovative therapists to rise up,
Yes.
this
Rise up.
is the year. Like I'm selling. Like I've never felt it more than I felt it
Woohoo.
this year. I was like, that's it. Like let's all unveil.
I
Let's own
know. Let's
ourselves.
do it.
You know, like this is what world consciousness needs is like people
Yeah,
like this. You
absolutely.
know, like no more textbook therapists.
No, please. We don't
Please,
need that.
we're good. No more. I'm done with it.
Well, let's end with what's a takeaway you could share with listeners who may be afraid of coming out of the holistic closet and haven't
Surround
really.
yourself with
Yeah.
evidence that it's possible to do this and be successful. So lean into
Yes.
practitioners who have already made the jump.
Absolutely. Mhm.
You know, like the lean on practitioners and like other groups, you know, your group,
Yeah.
like there are, you know, there's all these fears like, oh, well, I heard of this one person who lost their license here, you know, and I'm me. So I'm like, can I have that person's information? I'd love to speak to them. Oh no, like I, you know, can't get all right. So then to me, it's like one of those folk tales that like didn't really happen because I've worked with so many
Urban
lawyers.
legend.
Yes. And I'm just like, you know what? Like they're not going after this. Like as long as you got your ducks in a row, no one's going after this. But they are going after, you know, the lack of HIPAA compliance and,
Sure.
you know,
Mhm.
really hard dual relationships or poor boundaries where like therapists are sleeping with clients, you know, that's what they're going after. Like not, you know, if you say like, oh, I've integrated these in different interventions and they align with clinical theory and this is how I know they promote change and you write it in your informed consent and like you do your due diligence, no one's coming up to snatch your license.
Your due diligence. That's it, right?
No one's coming
Mhm.
up to snatch your license. So, and if you've ever been waiting for a sign, my friend told me this. She goes, stop waiting for the sign. You are the sign.
Yes. Here's
And
your
I was
sign.
like,
You're listening
there's
to
a
this
sign.
episode.
Listen to this episode. This is your sign.
We are telling you. So where can listeners find you and learn more about you?
Yeah, you can absolutely join the group. My Instagram handle is _black_sheep_therapist. My TikTok is at the Black Sheep Therapist. And my website, which might be getting an upgrade soon, is theblacksheepguide.com.
But thank you so much for coming on the podcast. This was awesome.
Yeah, it's my absolute pleasure. And thank you for even having this space. I remember when I first heard about you, Drea, when I first opened my group, I came across Drea. Drea was like, you need to talk to my friend Chris. And
That's
I was
right.
like, I will do that. Let me send an email right now.
Yes, Drea Bloom was on our podcast, this podcast twice. She's
Yeah,
awesome.
she's
Yeah,
amazing.
check her out if you haven't heard her yet.
Yeah, Therapist Tarot. That's her
Yes,
group.
that's right. Her group on Facebook. But thank you, listeners, for tuning in today. And that wraps up another episode. And if you have not rated and reviewed this podcast, please do so. So that helps attract other listeners like yourself who may be looking for community and also wanting to come out of the holistic closet and to connect. And this is Chris McDonald sending each one of you much light and love. Till next time, take care. Thanks for listening. The information in this podcast is for general educational purposes only, and it is given with the understanding that neither the host, the publisher, or the guests are giving legal, financial, counseling, or any other kind of professional advice. If you need a professional, please find the right one for you. The Holistic Counseling Podcast is proudly part of the Psychcraft Network.